Stroke is the fifth leading cause of death and a leading cause of serious long-term disability in the U.S., despite it being largely preventable, treatable, and beatable. And people diagnosed with a racing or irregular heartbeat called AFib, or atrial fibrillation, are up to 5 times more likely to have a stroke. So we're bringing in cardiologist and American Heart Association National Volunteer Expert, Dr. DJ Lackareddy. So thank you so much for joining us to talk about detection and management. But first, tell us about AFib, atrial fibrillation. I think I'm saying it right. What exactly is it?
Well, atrial fibrillation is a normal cardiac rhythm condition that can cause rapid irregular heartbeat, causing clots inside your heart that can subsequently get loose, go to your brain, cause a stroke, or congestive heart failure, or other heart-related complications.
So can you tell us some of the risk factors then, and who's most likely to deal with something like this, or who's most at risk?
Absolutely. I think age is a big risk factor there. If you're over 65 years of age, and then you have a history of atrial fibrillation in the family, you have untreated high blood pressures, diabetes, sleep apnea, prior heart attack, or other cardiac conditions, you are at a definitely high risk for atrial fibrillation, especially when you're a smoker and you also consume a large amounts of alcohol on a regular basis, your risk also goes up.
Okay, don't like the sound of that, right? So what should someone do if they are diagnosed or they believe right? What should they do?
Well, I think it's important to watch out for symptoms, which is mostly symptoms of irregular abnormal heartbeat, rapid pounding sensation, or butterflies in your chest. Some people may not have anything related palpitations. About 15 to 20% people only have fatigue, shortness of breath, dizziness, or sometimes your presenting manifestation could be a transient ischemic attack or stroke-like symptoms. So it's important to seek a physician's help so that you can appropriately be risk stratified. They can do some diagnostic tests on you so that you can confirm whether you have atrial fibrillation or not, and then have an appropriate management strategy with your goals laid out, both from a primary and a secondary prevention standpoint. You may be someone that may need to be on blood thinners. You may need rhythm medications, or sometimes you may also need a procedure called cardiac ablation that can potentially fix your arrhythmia.
Oh, wow. Okay, so where can we go for more information on all of this, doctor?
Well, the American Heart Association has an excellent online resource called myafibexperience.org. I'm going to repeat it. It's myafibexperience.org. It's a fantastic resource for patients as well as patients, family members, and friends to be educated about atrial fibrillation.
Wonderful. Well, thank you so much for helping us out with that today. I definitely learned something. I know our viewers did as well, and we're always on their side trying to help them out. So thank you again for that. And if you'd like to see this interview again, you can head to our website, and that's firstcoastliving.net.